were some clinical trials and registries that were presented. There were also the results of the ANNEXA-4 trial. So currently, when patients have bleeding and they are in the treatment with a direct inhibitor of the factor 2 thrombin, they can be treated with the daridorexant. And currently, there was few data about reversal of agents that are direct inhibitors of the factor 10A. And what they show was that Andexanet alpha also has efficacy and is able to revert anticoagulation of these patients. So probably we can also have an antidote not only for direct inhibitors of thrombin, but also for direct inhibitors of the factor 10A. There's also another important trial that were presented, the continuation of the RESTART trial, and they showed that there was a trend towards benefit from patients that had intracranial hemorrhage to reinitiate antiplatelet therapy. But these results need to be duplicated also in other trials. There was also the presentation of the SWIFT Direct trial, in which they studied the use of mechanical thrombectomy alone versus mechanical thrombectomy plus intravenous thrombolysis. And they weren't able to show that just doing mechanical thrombectomy was non-inferior to using mechanical thrombectomy plus intravenous thrombolysis. And this is also in line to other clinical trials that have been published. So what this says to us is that currently these patients should be treated with intravenous thrombolysis plus mechanical thrombectomy. It's not considered as a fair treatment to just treat these patients with mechanical thrombectomy. According to the current knowledge, we cannot think about currently to not do intravenous thrombolysis in these patients. And there was also a registry, there's also an important registry that was presented, the DECOMPRESS trial, and it was a registry of patients that had cerebral venous thrombosis and they had to undergo mechanectomy. And what it showed was that these patients overall, they had a good prognosis. There was one third of patients that ended up dying, it's true, but a considerable fraction of patients were independent, more than 2/3 of patients were independent at 6 months. So in patients with cerebral venous thrombosis, it seems that the use of mechanectomy is associated to a better outcome than in patients with ischemic stroke.